If vaginas feel threatened or violated, they close up. Much like a flower protecting itself from the cold, they protect themselves from harm. Vulvar pain can cause the pelvic muscles to tighten, which prevents women from being able to have intercourse, and the pain interferes with their daily lives. 3 years ago, my vagina was healthy. Then I began to get yeast infections every month before my cycle. Shortly after, I started feeling burning sensations during intercourse. I knew immediately that something was wrong, but I didn't have any explanations or theories about what was causing the pain. I was referred to a urologist who also treats women with pelvic pain, and he diagnosed me with vulvar vestibulitis, which is a category of the chronic pain condition vulvodynia.
Pain in the vulvar area is divided into two categories. One of them is called vulvar pain from a known cause, and the other is vulvodynia. Vulvar pain from a known cause means that the clinicians know what's causing the pain, herpes, infections, what have you. Vulvodynia is, by definition, totally unknown in cause.
I researched it online and discovered that millions of women have also been diagnosed with this pain condition. It was shocking to find out that the majority of physicians know little to nothing about vulvodynia.
I was trained in the mid-1970s as a family nurse practitioner, so not only did I receive very little education in women's health, but almost nothing in the area of vulvovaginitis, sexually transmitted infections, sexuality, pain conditions. I mean, I really had to build from my basic education everything into what I know today. I didn't come out of my education with much knowledge at all.
If you go to an OBGYN, their practice is usually focused mostly on childbearing. In fact, I went to an OBGYN for years when my daughter was small, who every single time I went would say, you know, if you're going to have another child, you should do it soon. Even though I had told her over and over again that I really didn't want another child. But that was what she was focused on, is that, having children. But there's so much more to genital health than having babies, but that's really the focus. So, I think that in the training of doctors, if they learn about anything, they learn about birthing babies and taking care of women who are pregnant. And, the other rest of your life, when you're not doing that, it doesn't matter. And that's a huge problem.
I've read and listened to countless stories of women who were told that their pain was entirely psychological. They are desperate for someone to listen because their pain is real and they need relief.
I had brought Dr. Stewart's The V-Book to my appointment because I had read that it's a good thing to do with doctors and it helps them understand what's wrong with you. And so I gave her the book and she said, "Oh, I don't believe this." And she threw it over her head and it hit the wall and slid down the wall and broke the binding.
Other doctors have, the reactions have varied from, "What the heck is that? Where did you learn about that? That doesn't sound like a real condition," to a doctor who actually was sexually harassed me and just made really inappropriate comments about my body and about my treatment, and that was right at the beginning. So that kind of tainted my experience going forward. I actually told him right after he said it and was able to confront him and tell him that was inappropriate for a gynecologist to speak to me that way, and I think that brought me some comfort of knowing that I was able to address it. But if I'm one woman who's experienced that, I'm sure there's thousands of other women that, so it's a combination of the lack of information of the doctors. Also, in my case, there was nothing physically visible to most of the doctors.
And as with many other medical conditions that affect women, if physicians don't really understand them, and there isn't very much research on it, they tend to be called, psychogenic conditions. So that definitely is something that has happened with vulvodynia for many years and is actually, unfortunately, still going on, where women go to their healthcare providers and are told that this is not, nothing is wrong with them. And they must be imagining these symptoms or something else is causing them to experience these symptoms. But there's hundreds of examples in medical history of conditions that the healthcare community doesn't understand that they've labeled as psychogenic or due to stress or anxiety. Stomach ulcers are a prime example. For decades, people were told that stomach ulcers were due to, stress and anxiety in their life, and until a study found out that it was actually caused by bacteria. So we have to be careful when there's no or very little research to have taken place on a condition, and if we don't fully understand it, not to then put the blame on the patient and label them as causing some sort of imaginary condition, because it's very real.
Living with invisible disabilities is extremely difficult because everyone looks at you like, you look wonderful. Look how beautiful you look. I mean, you dress really well. You seem fine. They're some of the hardest things because they're invisible.
This disorder needs to be brought to light, and these women's voices need to be heard. It isn't fair that women should have to internalize their distress and anxiety, which can consequentially result in cycles of self-blame, frustration, feelings of worthlessness, and depression.
I went to about 20 different doctors, running from doctor to doctor, trying desperately to find out what was going on with me. I spiraled down to the point of suicidality. The pain was so severe and so excruciating that I could no longer function. In other words, within 6 months, from being a healthy, vibrant, exuberant, enthusiastic young woman who was dating, who was working as a drama therapist, working, with young children, performing in nursery schools, different theater performances. I was very active, meeting with girlfriends every night. I spiraled down within 6 months to just lying in one place and just begging for God to end my suffering.
It's obvious that pelvic pain conditions need much more research. The negative stigma surrounding the genital area hinders women from feeling comfortable with talking about their vaginas and asking for help.
The things that we really need to focus on is on creating support groups. Creating places where women that suffer from these conditions can feel comfortable talking about their vaginas, talking about their relationships, talking about the frustrations that they've dealt with the medical world, talking about their fears. And from there, I believe that the next step that will come naturally is beginning to spread awareness.
So the therapy that I chose to do was a support group. I found group therapy through a support group, which is different than group therapy if it was run by, say, a psychologist. So I know that that's different. But the support group really saved my life. Really saved my life in so many ways. Through the support group, I heard about the specialist that I go to, and through her, I was able to get medication that has totally changed my life.
It's vital to realize that the vagina is a sensitive part of our bodies that needs attention and specialized care. Not only that, they deserve more respect than they are given by society and ourselves. This ideology is constantly spreading as women become more empowered and passionate, and doctors become more experienced and dynamic in their methods of treatment.
Coping with chronic pain is complex. I mean, no ifs, ands, or buts about it, regardless of the patient's age, circumstances, emotional situations. So you really have to work hand in hand with therapists, emotional therapists. I'm a big fan of hypnotherapy. I'm a big fan of acupuncture. I'm a big fan of Reiki. All the different complementary systems that are going to help patients tap into their healing potential, their memory of being healthy, their belief in being healthy. It's so key. Immune systems need the emotional strength to really believe in how to heal themselves. So I think that we have to help patients to cope in every possible way.
We've had the pleasure of interviewing some of these remarkably dedicated physicians, and their expertise is breaking new ground in terms of finding cures for women with chronic pelvic pain. I am just now realizing how powerful the connection is between the mind and the body, and how necessary it is to address both during the healing process. A more holistic approach that includes healers from multiple professions seems to be the most effective way of treating vulvodynia.
The way I came to doing this treatment was through my research for pain that for the patients that underwent OBGYN oncology surgeries. So I carried out a research project at St. Elizabeth Medical Center, and we treated post-surgical pain for women that underwent OBGYN oncology, basically pelvic surgeries, full hysterectomies. So I used these particular points, and we had a control group, and it was very kind of well-structured pilot study. So it seemed, there was a significant trend pointing into the kind of direction that these particular points may relieve some abdominal pelvic pain. So since I had already been seeing some vulvodynia patients by then, I thought that I would try that same approach on my vulvodynia patients. And while it's very hard to say definitively, but anecdotally from the patients that I've seen with that type of approach, I think we're getting some good results
from this. So how homeopathy works for vulvodynia specifically, I'll give you an idea of what would happen if a woman comes to see me for homeopathic treatment. Because it's so individualized, it's almost like making a custom tailored suit for that person. It's like you'd have to take a lot of measurements to make a custom tailored suit. In the same way, to find the one remedy that's going to match her constellation of symptoms, instead of taking measurements, what we're doing is we're asking a lot of questions. So of course we're going to ask questions about the specific condition itself, but we're also going to ask about, sometimes I ask someone to describe the pain. Let's say the woman says, it's like an angry pain, it's like a raging pain. That's very interesting to me because it makes me think she may have an issue with anger. Maybe it's anger that's not being expressed and her body's expressing the anger. Or maybe she's often in a situation that's making her angry. Maybe she's experiencing a lot of injustice in her life in some way. Maybe she's being squelched in a relationship. Maybe she has an abusive boss. So I might start with this specific. Of course, she's come in for vulvodynia, so I'll start talking about that. But I'll be listening for words or listening for themes that help me go deeper. And then I'll ask these really wide open questions like, so what kind of role does anger play in your life? How does anger show up for you? How do you express anger? Are you comfortable expressing anger? These kind of wide open questions to get her talking in a more freewheeling way. And gradually we're able to get to sort of more to the root of the problem. It usually takes about 2 hours. That's a typical length of time. And during that time, it's like I'm flipping through my mental Rolodex. I'm searching my database, let's say, for the remedies that I know that are likely to work in the female reproductive area, but also the remedies that are likely to work for what seems to be her core issue. Is it early childhood sexual abuse? Is it suppressed anger? Is it humiliation? Something like that. So there's a set of remedies good for the female reproductive area. There's a set of remedies good for her core area. And I'm thinking, out of those remedies, which one chooses to express itself through the physical symptoms she's likely to have?
So what got me inspired to become a pelvic floor physical therapist was really by pure chance. In 1994, I was able to meet this wonderful physical therapist in Chicago. Her name is Rhonda Catarinos, and she really has been sort of one of the big physical therapists in the world of pelvic floor, and I was able to shadow her and see what her work was, and I got really inspired by listening to all these women that are suffering from pelvic pain, which is a totally new concept for me, and she was really helping them, and these women were so thankful, has changed their lives. So I said, why I cannot do the same thing? I love my profession, and I got some guidance from her, and I started to take some courses, and that's how I became a pelvic floor physical therapist. And go through showing them this pelvic anatomy model, because most of the women really don't know that we have actually muscles in the vaginal area. We only think of a cavity, but we don't know what it's composed by. There is a group of muscles called the pelvic floor muscles, and these are the muscles really that are the culprit of all the problems that women come here for, because these muscles become very tight and short. So these muscles are born underneath the pubic bone, and they run all the way into the coccyx on the right and on the left, and that is the deepest layer that you can see there.
I now know that women with vulvodynia are not vulnerable or broken or helpless. It has become apparent that we need to embody the truth, that we are intuitive, perceptive, and compassionate women.
It has to be spoken. And again, vagina. That's not scary. We have to be able to say that, and to say that with pride. And to say, my vagina needs help. Please listen to me. There's no shame.
Genital pain has a purpose, and the outcome is a deeper understanding of ourselves and respect for our incredibly complex bodies. Every person we've met through the process of making this documentary has added his or her own positive energy to this cause, as well as my own personal healing. They offer continual hope for the future of vulvodynia.